how are you feeling today? I know you said you've been in the hospital a couple of days. How's everything been?
Today is day 14 for me with COVID-19. The last 4 days I've been hospitalized here at Mountain View with low oxygen and lung capacity. And I've been diagnosed with double pneumonia, COVID pneumonia on both of my lungs. Today is the first day that I've woken up and felt a little bit stronger and better because they've been filling me up with a lot of antibiotics, steroids, and blood thinners because they don't want my blood to clot. And I feel finally like something's happening with the medicine, and it's allowing me to feel stronger. Thank God.
You were admitted into the hospital 3 days ago?
I was admitted into the hospital on the morning of 4th of July. I was at home monitoring my symptoms, and I have an oxygen reader at home. And my oxygen that day was falling below 90%. It was in the low 80s. And I watched it for a good 40 minutes. And I finally said to my husband that I either need to call an ambulance or I need you to get me to the hospital because I can't breathe anymore on my own.
That's very serious. And especially since you're 39 years old, on all accounts, you're a young, healthy man, I would assume, before COVID started?
Yes, ma'am. I'm 39 years old, living a normal life, my dream career of being a principal here in the district. I was following social guidelines, washing my hands, making sure we were safe. And I woke up one day and my life changed. And it's scary to think that at 39 years old, you can't breathe on your own because of a virus that's taking over your lungs, and the possibility of not making it. And having those conversations with family and loved ones at 39 is something nobody should ever have to deal with.
Do you have any idea where you may have gotten COVID?
To be honest, no. There was a stretch of time before I got sick that we were again wearing masks and being safe. So I have really no idea where I picked it up. I just know that we did all of our things we're supposed to do, and we still ended up with it. Me and my husband both tested positive.
And how's your husband doing?
He's much better than I am, Kristen. His path is the complete opposite of my path. He had minimal symptoms. He lost his smell and his taste and a bit of a headache and tired. But thank God he didn't go down the route I went. And he was able to take care of me for those first 9 days at home, where I walked through hell, pretty much fighting for my life.
When you're saying you walked through hell, what were those days like up until the point you said you can't breathe on your own?
So my symptoms started with me waking up and throwing up, and I had a very high fever, about 103. And every day it was the same thing over and over. Fever spikes, uncontrollable chills, nausea, body aches, to the point where I would have 4 or 5 blankets on me and I'm still freezing cold. Or then my fever would spike to 103 and I couldn't eat and I couldn't sleep, and just being in the worst pain you can imagine. People want to say it's like comparable to the flu, but it's the flu times 100, 24 hours a day. You wake up and you think, what's going to happen today? What's this virus going to bring to me today to really test me? And it's truly something no one can prepare for because it affects people so differently. And it's taken so much out of me, and I'm trying every day to fight it.
You're a principal within the Clark County School District. The fact that you got COVID, there are lots of discussions right now about how to reopen, what the school year will look like. But since you have that experience, I mean, what do you want the school district to know in regards to this and the precautions that need to be in place?
I really feel like the school leadership above me, my region supervisors, our superintendent, and I really feel like the school board are really sitting down as a collaborative team and working hard to figure out the best solution. I love my job. I love my kids that I get to work with. I love my teachers and my support staff. I love my community. And I know everybody's working really hard to find solutions to bring us back together safely. And I trust in their ability to make those decisions. And just my biggest thing is I need everyone to realize we need to work together, because it's not going to be a single person to decide. We have to come together as a community to keep us safe, keep our children safe, our staff safe. And we're going to need a lot of patience and a lot of flexibility coming, because there's two things that I'm looking forward to, Cristen. One is rolling out of this hospital and wrapping my arms around my family. And two is seeing my kids back at school and my teachers back at school, and seeing their smiles and reminding me why I did this job and I love my job, and be there for them.
I know right now your focus is on the recovery aspect, your life, but you also mentioned you love your job, the students. For you, how do you want to try and keep everyone safe? Because COVID is not going away anytime soon from what we're seeing, especially our numbers are continuing to go up. So how do you want to make sure when everyone can come back together, they're all safe and no one has to go through your same experience?
Just making sure that we're all trained in the latest CDC guidelines, and ensuring that my school buildings enforcing those social distancing guidelines in the classrooms, and that we are having our kids wear those masks and our children feel safe at school, and having our parents feel safe to send them to school by limiting the number of kids in our classrooms, and just being really aware of what's going on around us in the building, and making sure we're cleaning and sanitizing and keeping our kids safe. And so yeah, just following those protocols and guidelines, and ensuring they're happening in the building.
Do you think it's enough? Because even you mentioned you were following all the guidelines and this still happened.
I do. I don't have the right answers. I think it will be enough as long as we're diligent and people practice these CDC guidelines and work with their children. And it's a community effort to keep all of us safe, and keep all of our kids safe, and keep all of our teachers safe and support staff safe. So it's not just the efforts of me and my building, it's the efforts of me and the community.
Right now, how is it even just talking with me? Is it a struggle to breathe?
It is, I'm still in my infancy here at the hospital with my treatment. And so, the breathing comes and goes. But like I said, I feel the medication is helping. And I'm hoping I'm on a road to getting pneumonia out of my body and getting better.
What has been the toughest part so far through all of this?
The toughest part is being 39 and talking about dying with my husband, and what that would look like, and how he would move on without me, and what would happen. And I can't imagine I've had to have those conversations with my loved one, being so young.
And he can't physically visit you at the hospital, but have you been able to FaceTime him during your stay?
Yeah, no one's allowed to come and see me, and I'm isolated in my own room and left to my own thoughts. but thank goodness for FaceTime and technology. It gives me some hope and something to look forward to.
Speaking of hope and what to look forward to, yesterday you did do a Facebook Live, a lot of love, a lot of comments. What was it like sharing your experience and reading all those messages?
Yesterday was hard, Cristen, because the doctor dropped a lot on me yesterday, and it was very touch and go if I was going to go to this new intensive unit for care, and just brought a lot of emotions to the surface, because not only am I fighting for my health, but it's also being here alone and fighting those mental demons sometimes too that creep in when you're alone and you're dealing with this massive virus. And so when I posted yesterday, it was raw and real, and just me being the truth, my speaking my truth and what was happening. And my video got so many comments, and the messages are beautiful. And I've gotten messages from around the world, actually, people reaching out to me and supporting me. And I'm just trying to tell my story so people realize that this is in our lives, it's in our society, it's happening, and it can happen to anyone. No one's immune to this. No one's, safe from it. It can happen to anyone.
I guess that is the big message that you have been wanting to share, because people hear about COVID, but it seems you don't really understand the impact until it happens to you, someone you love, or someone you know. It's just something people think they're hearing about. Is that how your perception was originally before you got it?
Yes, ma'am. I felt like there was a, excuse me, I felt like there was a narrative in society, especially in Vegas, that it's safe. Go out. You don't have to wear a mask. Go to the casinos and go eat out, and it's going to be okay. And that kind of narrative that was out there allowed me to feel a little bit, okay, maybe I can go out and not, worry so much about the virus. And look what happened to me. It turned my life upside down in an instant. And I don't want anybody else to have to go through sitting in a hospital room by themselves, contemplating if they're going to live or die for a night out at the casino.
You mentioned, contemplating about whether you're going to live or die. I know I spoke with a teacher yesterday. She mentioned that there are educators who are getting their affairs in order right now, their wills in order, because they're nervous about returning to the classroom. Do you think that they're in the right mindset to get a will at this point in time before returning to the job, just in case this happens?
I think everyone's perception is their reality, and I think their actions are validated if they feel that way. And, as a leader, as a building leader, part of my job is to support them no matter how or what they need. And if that's something they need to get in order to feel comfortable or to feel safer or to feel proactive in the situation, then I support that. And I know I have a lot of teacher friends from my career that are nervous about going back to school. And we're really just hoping that our leadership and the school board work hard to ease those fears that a lot of people have about coming back to the school year, and really develop a plan that's going to work for all of us to keep us safe. And so we'll have to wait and see. I do believe in our leadership. I know their hearts are in the right place, and that's all we can ask, is that these people have their hearts in the right place for everyone. And I know they do, and they're looking out for us.
So what is the road to recovery right now?
So the doctor is continuing with the steroids and the medications and the flushing and hopefully getting the fluid out of my body. The biggest concern for them, Cristen, right now is obviously the pneumonia. They need to get the pneumonia out of my lungs so I can breathe. And fingers crossed, treatment continues. I know the doctor had mentioned it's about a 10-day approach. We have to see what my body does with what's going in it. There's been some suggestions from the doctors about alternative treatments like using plasma from a recovered COVID person, and another treatment of that's been around nationally floating is the remdesivir treatment. They might do that as well. But right now, they're waiting and seeing of what they've done so far and looking at x-rays and evaluating as a team here at Mountain View, who have done a wonderful job with me.
Well, I appreciate you taking the time to speak with me. I don't want to stress your lungs out too much anymore. Is there anything else that you'd like to add or want to let the public know?
I want to say thank you from the bottom of my heart to everyone that's reached out to me and sent me messages of encouragement and have sent prayers and raised me in spirit and kept me in positive energy. You don't know how much it means to me being here alone in this room to have thousands and thousands of people in my corner. And I just want everyone to be safe and realize that it's real and it can happen, and just be very diligent in everything you do in your life and realize that it can change in a heartbeat.
Thank you so much.
Thank you, Cristen.